there. Today I'd like to talk a little bit about the diaphragmatic breath and a belly breath. I've taught both for many years using that language, but in recent years I realized that if I think about it anatomically, calling the breaths those terms doesn't make a whole heck of a lot of sense. And I started noticing more and more that when I was asking clients to show me what their diaphragmatic and or belly breaths looked like, often this is what would show up. So imagine this ball is my abdomen. I can turn a little bit sideways so you can see. And I'd ask them to demonstrate their belly breath, and they would show me this. So I'll do that a couple of times so you can see that what they would be doing is bulging out the belly, which why not? We're calling it a belly breath. It makes sense that they think that's what we want them to do. And I'm sure that's what I did for the first few years of learning a belly breath as well. But what most people end up doing when they do this version is they're contracting their abdominals to push out the belly. So they're not actually using the diaphragm efficiently, which is the whole purpose of a belly breath. So to me, I think it makes more sense to call it a three-dimensional breath or a 3D breath, because what you really want to happen, so again, imagine this ball is my belly. Imagine my hand is the diaphragm. So as we breathe in, the diaphragm drops down, and when it drops down, it puts a compression on all of the contents of the abdomen, all the organs and viscera that are in the abdomen. So as a result, the volume gets dispersed and we get this three-dimensional filling front, side, and back. That releases when the diaphragm floats back up on the exhales. So just watch that action of the ball for a few cycles. Inhale, the diaphragm drops down, compresses everything in the abdomen. Exhale, it floats back up. They return to their normal positions. So this nice, beautiful, flowing and floating action of the diaphragm creates this compression relaxation of the abdominal viscera that helps to pump them. It helps them to do what they're supposed to be doing physiologically speaking. It helps them to be more efficient with what they're supposed to be doing. And at the same time, it helps the body to rid toxins, because when we don't get that natural pumping, things can get a little bit stagnant. So I had demonstrated in one of the other videos, I used the hippie stick to show you the action of the diaphragm. So let me try to combine those two, see if I've got enough hands. So the hippie stick is the diaphragm, the ball is the contents of the abdomen. So at rest, the diaphragm is higher up. On the inhale, the diaphragm drops down and that compresses the contents of the abdomen. Exhale, diaphragm floats back up and the contents of the abdomen change back to their normal configuration. And this is what we want, both when we're talking about a diaphragmatic breath and when we're talking about a belly breath. We are not looking for this bulging of the abdomen only, because that's actually going to put a strain on the lower back, which is certainly not what we're looking for when we talk about a belly breath. And then just the term diaphragmatic breath. All breath is diaphragmatic breath. Our diaphragm is the primary muscle that breathes for us all day, every day. So every single breath we do is a diaphragmatic breath. I think what we're trying to impress upon people with that term is that for many people, for most people, our diaphragm is perhaps not working so efficiently. So we're trying to teach them to use their diaphragm to create that jellyfish floating up and down action of the diaphragm with their breathing. But I think it creates a bit of confusion for our students by calling one breath a diaphragmatic breath when all breath is a diaphragmatic breath. The only time we're not using the diaphragm to breathe is if you have a neurological injury in the cervical spine, maybe you're quadriplegic, for example, and the phrenic nerve has been damaged. And that's the one time that your diaphragm is not breathing for you. But it is true that most of us don't use our diaphragm as efficiently as we could. So learning all these different breath techniques can help us to get that better. I just wanted to clarify the terminology so that there's no confusion.